Welcome back. In a few minutes, I will talk to Jackson CEO Carlos Magoya. But first, we should remember Araceli Buendia Ilagan, better known as Celly. A Jackson ICU nurse, she died 10 days ago after being infected with the coronavirus. I asked Martha Baker, the head of the union who represents 5,000 healthcare workers, to talk about her friend, Celly.
We all knew Celly. She was one of those hands-on assistant nurse managers who would not let you work by yourself. She was probably going in and out of every single room in that 20-bed ICU every day, despite the risk of COVID. Not only is she a good friend of mine and a good friend of many, she's our first. She's our first to fall. And it's hard.
How are people dealing with it? I mean, it's got to rattle folks as I see the emotion on your face, and how are others at the hospital coming to grips with not just this first death, but the possibility that this may not be the last death among healthcare workers?
I think everybody recognizes, sadly, that she may not be she's the first, but she may not be the last. And, we just have to be extra careful. The risk of this COVID is very real, and obviously it's touched us in a very real way. Sometimes I think the people that work in the ED or, they know every patient coming in is at risk, and they're gowning and gloving and masking, and, they're treating like every patient is. And I'm not, in some of the other ICUs, trauma ICU, for example, where I managed for almost 20 years, those units, and perhaps CSI and SICU, they're not supposed to be taking COVID patients. They're not supposed to be having COVID patients. So, if somebody, you or I would get in a car accident and we're in trauma, they're not thinking we're COVID, but we very well could be. And that's the dangerous part to anybody there, is that these patients coming in, we're not able to test everyone. We're not able to test each other as coworkers. Well, who did you, bring from home? What did you bring from home? And, we're finding, everybody's heard about the Jackson North nurse that was COVID, and she was at work and didn't know she was positive. She went home sick and was 6 days with her family and didn't know she was positive. It was, you don't find these things out. And then retrospect, you realize how many people you touched, and literally touched.
Are your members scared? I mean, not just for what's to come, but for their own safety, their own families. I know that they'll still show up and do the job, but what sense do you get from the doctors and nurses you represent in terms of how nervous and scared they are right now?
Yeah. Well, I tell you, I'm so proud of all of them. When they call, they don't talk about themselves. They talk about needing, equipment to do their job safely. I'm sure they got to be scared. They're human beings, but that doesn't bubble to the top of our conversation. And if I were to ask them, how scared are you? That could probably be a whole nother conversation. But they're healthcare professionals, just like the first responders. I mean, when 9/11 was happening, we didn't ask the firefighters, are you scared? I don't think. We talked about what a heroic job they're doing and how are they dealing with this stress and how do we keep them safe. And they're a lot of the same. I mean, I think we could, I think every one of them has to have in their back of their mind, how can I stay safe? And how do I know I don't take this? I know some employees are self-quarantining themselves even from their family at home, and they're seeing their family, from afar. I think you saw on TV that one doctor was kind of waving through his kid through the glass door, and he's staying in another room where he doesn't enter into the same living quarters as his family. So I think a lot of people are taking extra severe safety measures to make sure they don't infect others, but they're very unselfish about the way they're dealing with this. None of them, when we get on, we're Zooming, doing membership meetings, talking to clusters of members, all day long. And people are mostly saying, the PPE, it's not showing up fast enough. They're feeling like it's not there, and I'm trying to convince them and push on management to deliver it faster. But, they're talking about, how do we stay safe when we found out that one of my coworkers was positive, a doctor was positive. who gets tested? Do we all get tested? How do I know I worked with him side by side? How do I find out if I'm positive? But they're not, I think they're really concerned about how do we keep this manageable? How do we, every strategy is to stop it from spreading. And if we don't know who has it, how do we do that?